Welcome to the Mizzou Health News Network, your source for information about medical care, education, and research at the University of Missouri. The University of Missouri is now home to one of the few therapeutic rehabilitation playgrounds in the country. The playground serves children who use wheelchairs, crutches, and other assistive devices. It also features images and obstacles that teach children how to navigate their environment, build muscle strength, and improve coordination. Created with support from generous donors, the $270,000 playground is part of a new therapy center at MU Children's Hospital. The center includes a variety of specialized equipment, including bikes designed for children with spinal cord injuries or illnesses. The center's rehabilitation and therapy experts also help children with cerebral palsy, traumatic brain injury, autism, and a variety of other illnesses and injuries. Central Missouri's only orthopedic oncologist has arrived at MU. Dr. Andrea Evenski is now treating patients at the university's Missouri Orthopedic Institute and Ellis Fischel Cancer Center.
We need all the resources at the institution that we practice at to be able to provide the best patient care. What allows me to complete my care on the patient is having Ellis Fischel Cancer Center. This provides the patient with a multidisciplinary team of medical oncologists, radiation oncologists, pathologists, and surgical oncologists.
We've been sending a lot of the orthopedic oncology out, and therefore our patients would have to travel and go to places such as St. Louis or even further away. And having her here allows us to keep those patients at home, allows us to provide them a better continuity of care right here at Ellis Fischel. So we're very excited to have this new service line offered here at Ellis.
Work crews and building planners are preparing for a new medical education space at MU. When completed in 2016, the $40 million construction project will allow MU to increase its medical student class size and create a clinical campus in Springfield, Missouri. At MU's largest ever corporate roundtable in November, clinical campus partners Cox Health and Mercy Health Systems joined the university in explaining how the project will improve patient care, education, and the economy.
And when this campus is at full bore, the economic impact is around, for the state, is around $400 million a year and about $325 million for Southwest Missouri. And we'll train a lot of physicians who will stay in the state and stay in Southwest Missouri.
Hundreds of former medical students and their family members returned to the University of Missouri School of Medicine for homecoming. The school's 56th annual Physicians Alumni Weekend included the largest 50-year reunion class in homecoming history. The class of 1963 was recognized at a banquet, where the school also celebrated the 20-year anniversary of its internationally admired patient-based learning curriculum.
We're very fortunate tonight that we still have some of the original educators who helped to bring about this change with us tonight, and I just want to call out a few of those who are with us who were there 20 years ago when this first all started. We have Dr. Ann Havey with the Department of Pathology and Anatomical Sciences, Dr. Mike Kosakawa with Family and Community Medicine Department, Dr. Betsy Garrett also with the Family and Community Medicine Department, Dr. Mike Misfeld with the Department of Molecular Microbiology and Immunology, and Dr. Ted Groshong, whom you've already met, with our Department of Child Health. Please join me in applauding these contributions that they have made.
Also at homecoming, many alumni participated in a scientific program by sharing what they had accomplished since receiving their medical degrees from MU.
The enthusiasm of my faculty at the University of Missouri, Columbia, planted the seeds which gave me my lifelong interest in advocacy for patient rights, human rights, and bioethics.
I was able to fulfill a lot of things while I was a med student here, found out the specialty I wanted to do and matched in a great residency program, and then did fellowship at Harvard a few years after that. So my Missouri education always has provided great opportunities for me to be able to continue that education and open up great career opportunities throughout my career.
More than 120 students participated in the University of Missouri Health Sciences Research Day in November. The annual event at MU's medical school includes a research poster contest, lectures, and awards.
Research allows students to dig deeper into the academic environment and allows them to get a chance to explore what they can do for the future.
Well, as an academic health center, we really think of three missions. We think of clinical activities, we think of education, and we think of research. So we want our students to leave their training programs with some ability to contribute to the larger body of knowledge. And so it's really important in their training opportunities that they are able to engage in research, learn from mentors, and actively participate and have a hands-on experience. So they can learn not just from their books, but also from the labs and from the clinical work, clinical research areas that they pursue.
Students, faculty, and staff throughout the University of Missouri Health System are observing the holidays. Many are celebrating by helping those who are less fortunate. Employees have sent donations of money, food, toys, and other items to community organizations that serve people with financial needs and disabilities. From our family to yours, happy holidays from the University of Missouri Health System. Learn more about MU's health system on YouTube, Facebook, and Twitter.